I've had chronic low back pain for, I'd say, over a decade now. In the past year, it's become somewhat debilitating. Taking away from my sleep, taking away from my exercise, taking away from my sports. Just quality of life has just kind of gone downhill. Yeah.
What else have you noticed that's been difficult for you to do?
Standing up out of a chair hurts. Laying down flat on my back hurts. Sometimes a random bending over doesn't hurt, but trying to lift myself back up is very painful. And this is pretty much my last stop before surgery. I've seen actually one of the best surgeons in the country, and I was supposed to schedule my surgery last week, and I found you, so here I am.
Gotcha. What other things have you tried for this low back?
I've done other chiropractic care. I've done cortisone injections. I've done physical therapy. I have a standing desk at work. I do hot yoga. I have an inversion table at my house. I've pretty much tried everything.
So how's that inversion table? Any help with that one?
Not really.
Kind of figured.
Yeah.
And you also tried PT and
physical therapy, nothing. I've done massage therapy. Sometimes just heating it up. I take a lot of Epsom salt baths, so that's just to kind of manage the pain down a little bit, but no constant relief.
I hear you. All right, let's take a close look, see what's going on.
Let's do it.
All right, got something here. Okay, you got something way below your lumbars. Yeah. Okay, we've got some noise here. All right. So yes, I do see some swelling over here. Muscles are tight on both sides, more so on the left-hand side here. Got some puffiness around here. Also a little pooling around here as well. How's this fella right here?
It's a little tender.
So since this is a long chronic standing issue for the past 10 years, right? I wouldn't be surprised. Oh, how's this fella right there? Yeah, see, I feel this huge band right there. It's like a huge speed bump right in that spot right there. How's this fella right here?
Yeah, it's a little tender too.
A little tender too, but not as bad as the left.
Not as bad as the left.
All right, let's see what's going on here. Yeah, see, there's a big speed bump we got going on here. Huge swelling right there. See, that's the second sacral segment. How's that fella right there?
Yeah.
That's not fun, right?
No.
Right. We're trying to find that fella. Let's move on up. How's this fella here?
Well, a little bit, not as bad as down below.
Not too bad. That's your fifth lumbar. Right. And it's moving. Right. So I'm going to touch base on that, going over your x-rays. Yeah, this is jammed up. Yes, and I also see right off the bat here too. So you just got quite a bit of swelling right here. And you can relax your hands there. See, also muscle spasms here too. So when we check these areas, is that knot over there?
Yeah.
Yeah, right. So you also have another knot on this side too. So your body's trying to stabilize and protect something here that's very unstable. And we'll take a closer look on the x-ray and see what's going on with that fella. Yeah, see? I could tilt your head to the left. See that? To the right, I could tilt to the left. That's not moving.
No.
See? So there's something going on in that sixth cervical. Okay, so here's the story with your case. This is what I'm seeing. Now, this is your fifth lumbar disc.
Mm-hmm.
Right? Now, based on what I'm saying, all these discs over here, they're all swollen. Okay, so these are disc bulges, disc herniations. Right. Now, what's normal? This is what we're trying to look for. This is the nucleus pulposus. This acts like a ball bearing to pivot all directions. Right. Now, if at any point if it's compromised and start moving backwards due to a trauma, right, the whole entire structure will start moving backwards like this. And as we see over here, the nerve, it gotta come out of that tunnel. Right? But if it starts shifting like this way, we see the tunnel starts collapsing. Right? And our nerve, what happens to it? It starts getting irritated. Right? And that's not gonna be a happy camper. So as we see over here, the tunnels over here, they're fine. So they get narrow, very narrow, and where the heck did it go? Right? It's very narrow in there.
Yeah.
Now, the other component is this. We see there's like a little sphere shape over here. See that right there? That's what this is. Okay. That's been in there for so long that it actually dented the bone. We also see the sphere shape over here too. See, that's supposed to be smack in the middle, but it's not. There's another one, a sphere shape over here, another one over here, another one over here, another one over here. So since all of them are backwards, that tells me that, no, a long time ago, this fifth lumbar actually used to be like this. But because it broken down so badly and worn down, to the point that now we have this poor fellow right here. Everything's all broken down. You pretty much, even though this is the worst case scenario, you actually still have a small little tiny bit of that ball bearing left. Right? It's very tiny in there. But however, things collapse. So instead of having that inferiority like this, it broke down to this. So we're not so much now, the tunnel is like, it's almost completely collapsed to the point that it may be, the bulge may actually be pinching the nerve. Now, is it really pinching it? It's hard to say until I see the MRI myself, but I wouldn't be surprised if it is. Now, the other component I want to tell you is this. Okay, can we actually rebuild and recover this thing? Well, that's a tough call. The important thing is you do have that ball bearing still in there. That's what's important. Because if it's completely gone like this, then I would say, yeah, even I can't help with that because it's gone. You got to have some kind of ball bearing in there. So when we had this kind of situation where from here normal, I want to see this healthy ball bearing, over the 10-year progression, you went from here to here. Now you're like almost here, right? But again, like I said, you still have that little ball bearing in here. It's just not a lot. It's basically the size of a Tic Tac in there, right? Not like this size, but like I said, the size of a Tic Tac or even half of a Tic Tac. It's very small in there. Can it grow back to here? Well, that's the point I was about to mention. There's a line of point of no return. Either you're on the line itself or you passed it. I don't know. Only time will give us that answer. But can we get from here, like from here to here? That actually, your body can regenerate from that. But we're saying that if it didn't pass that line of point of no return, if it didn't, then we're talking about 20 to 25 years. That long. Why? Because the damage really is that extensive. So there are things you can do to help accelerate that process. And we're going to touch base on that. The key component is we have to correct the underlying issue that drove that in the first place. It's actually here, that second sacral segment. There's an open gap over here. That's what's caused all that instability and made this one, bam, knocked out even worse. So because of this instability, the body says, hey, wait, what the hell's going on over here? We need to make this stable. But unfortunately, that fifth lumbar bone, because the foundation's unstable, it was doing like this. And it wore out so much, keep on doing this over a period of 10 years. Now it got to this, where, nope, it's not just doing too much over there. Right? So, in order for that fellow to try to regrow back, and again, I'm not guaranteeing it because you either may be right tiptoe on the line or you may already cross it. I don't know. Right? Because I can't see the future. So I can only tell you that this fellow over here, we need to address the root underlying cause. This is what you knocked out way back then that caused this one to break down. Once we address this one, then we're talking about there's some things you can actually do to help regenerate this fellow, which is, first things first, we're going to plug up that hole. Right? How do you plug up that hole? Your body needs collagen.
right? So how do we fill it with collagen? Well, I do recommend, are you a vegan or no?
No.
Okay. So there's collagen supplements.
Mhm.
That's step one. Okay. Bone broth is even better.
Okay.
Right? Because there's a lot of collagen in there.
Mhm.
Okay. And number three, I also do recommend take a lot of natural vitamin C. 1/3 of collagen, the makeup, is vitamin C itself. So there's a lot of, I want you to eat natural, healthy vitamin C, not the one that comes in a pill or a powder form or anything like that. The reason why is because most of them are produced from a fungus.
Mhm.
Right? I want you to eat, from a citrus, strawberries, guava, okay, because all these things actually have the highest amount of vitamin C. Okay, guava has roughly about, I believe, like 3 to 4 times more vitamin C than orange itself.
Mhm.
So I want you to eat a lot more stronger stuff vitamin C because we gotta really rebuild that thing.
Yep.
Okay? The highest amount of vitamin C actually is in chili peppers. Okay, those red, like those peppers, whatever it is.
Yeah.
But I don't think too many people are gonna tolerate eating too many of that stuff there. So the next best thing is actually guava.
Mhm.
Okay, watermelon. What else is it? Bell peppers.
I eat a ton of spicy food, so it might work out.
Well, we're gonna eat a lot more. Okay,
Okay.
so we're gonna have a lot more vitamin C. But you gotta spread it out throughout the day because if you eat way too much, you may have diarrhea because that's what happens when you overdose of vitamin C itself.
Mhm.
But again, we gotta fill up that hole.
Okay.
All right, that's the key. So again, strawberries, that's quite a bit. Guava, broccoli.
Yep.
You'd be surprised. Even broccoli has a lot of vitamin C in there too. And the interesting thing about it also has a lot of natural calcium. Again, I don't want you to take the fake calcium stuff.
Mhm.
That comes from an oyster. That calcium is already depleted.
Mhm.
Okay, we're talking about the oyster already, used it up.
Yeah.
So there's not too much left for us to use.
Mhm.
That's why we only absorb maybe roughly 10% of it
Mhm.
out of the whole entire tablet. But if you eat broccoli, okay, viability is nearly 100% because it's fresh calcium. We could use all of it.
Yep.
Right. So that's how we're going to try to get that thing to rebuild. And that's going to be a long process. As I said before, 20 to 25 years. Let's see if we can speed that up. Maybe we can cut it down to 10, 15 years. I don't know. Only time will tell.
Okay.
All right. So let's jump over to the MRI.
Let's do it.
So this is what we already confirmed. Okay, this is what the MRI shows. Yeah, you still have that nucleus pulposus. See, that's what that is over here.
Mhm.
But it's so badly damaged. See that disc?
Yep.
Badly damaged over here. And it also is extruding outwards over here. That's what's pressing upon the sac itself.
Mhm.
All right? And we see over here, even here, see that's the nucleus pulposus, just like we alluded to before, it's backwards. It's supposed to be in the center, but it's not. Same story with this one. This one as well is starting to migrate backwards. See, this one is also, it's not in an ideal position either. This one's also backwards. So the fifth lumbar disc, fourth lumbar disc, these two are badly damaged. This is what we call disc herniations.
Mhm.
And you did mention about that going to the surgeon or what have you, but here's the thing. If you operate on this fellow, it's still not going to solve the underlying problem because this is what we mentioned before. See this over here?
Yep.
It shouldn't be there. Okay? It's gapped wide open like this. So the problem is actually this one right here, that second sacral segment, because it's supposed to be fused like this. But because that problem's been there for so long, it never fused.
Mhm.
Right? So this is actually the culprit we need to address. And on top of that, we also confirmed, going back to things, we also confirmed another thing too. If you recall, I tested your fifth lumbar, right? Now, one of the indicators, a couple of indicators is this. We used the instrument.
Mhm.
There was no heat reading at this particular level, okay? While yes, there is swelling at that level, that's indicator one, but is there any heat reading? There wasn't, okay? And number three, we also test for, okay, is there any fixation? Okay. Normal, it should move. Abnormal, it will be stuck. Right? Now, when we tested your fifth lumbar, it was actually moving. So that tells us the problem, actually, this is hypermobile. Meaning, it's just like what we alluded to before, because the foundation is so unstable, the fifth lumbar is moving too much. So that's what it may explain why you try so many other therapies, physical therapy, and so on and so forth. When they try to move and try to correct this fifth lumbar, it didn't do anything because it's already moving too much.
Mhm.
So the real answer is no. We're going to provide stability. We do need to address that foundation, correct this one, and then finally get a firmer foundation over here, and the fifth lumbar will start coming down.
That's going to be the strategy in your case. All right, let's see. Going back to the other stuff, what we already found out, yeah, that mid dorsal over there, because the way your spine is, due to the way this has been going on, breaking down slowly, your spine's been steadily going like this, right? And it puts so much tension. That's what we're feeling here, right in the middle, right there. And that's why the rest of your spine did this way as well. So we do need to address this, and I may need to address that 6 cervical as well over here. And this 6 cervical seems to start with this one over here, okay? You also have a disc bulge over here. That disc is just not happy, right? So we may need to address this one. I'm going to double check. Main thing is right now, let's correct that fella. A little more. Just let it sink. Just relax. Ooh. There's the biggie. Okay, stay right there. Drop. A little more, just a little. Good. Just let that go. A little more. There's the magic. Come on up, sir. Yeah, go ahead, walk around.
I can feel it already.
What do you feel over there?
I feel like a ton of pressure was just released out of there. That was a heck of a pop in there.
Don't go too crazy in that. That thing's delicate. We just corrected it.
Yeah, it's like a ton of pressure just went out of the window. It feels a lot better. I mean, I came in here, it's in constant pain. I don't feel it when and oddly enough, I've been getting, I guess maybe, I don't know if it's residual, kind of this pain that's creeping around the hip a little bit.
That's exactly what that is. That's second sacral segment.
And it literally just disappeared. Literally.
There you go. We corrected it.
I want to hug you.
Yeah, you go ahead. Come on.
Bring it in. Oh, man. Thank you.
Oh, you're very welcome. What other changes you notice? Anything with the mid back? You were complaining about that before.
My whole back feels looser. I feel like my muscles aren't as tense back there anymore because it's constantly. I feel like almost as if I'm flexing all the time, but I'm not. So they get really tired back there. And the low back. I mean, that's just where all my attention is because, like I said, I mean, it's been miserable. I was just about to get surgery. I was gonna go in and schedule my date, and just the thought of having a spinal fusion just wasn't ideal. So this is amazing. Thank you.
I'm glad to hear.
Yeah.
All right, champ. So here's a story, okay? Because we just corrected that one, and on top of that fifth lumbar, it's moving way too much. It's gonna need some time to calm down. So right now, okay, don't do any heavy, like bench presses. Actually, not bench press. What you call like leg presses or power cleans, deadlifts, something like that. You gotta let that thing heal up. Okay. Do you still do all that stuff, or not really?
Yeah. So avoid the gym altogether, or
no? You could do arms. You know what I'm saying? You could do like other ways to work out your legs or chest or things like that. But the low back, it needs time to heal.
Okay.
Right? Because we just did a very powerful correction for that sacrum over there. The foundation itself, that one usually takes bare minimum 1 to 2 months to really bond and get really strong.
Okay.
All right.
And it'll stay together.
It can. The way we corrected you on that particular table, right? That thing usually holds somewhere between 3 to 6 months. That long. Okay? The longest I've ever seen was it holds about a year.
Okay.
But it varies from patient to patient. So that's why I'm going to do a follow-up next visit. Right? Let's see how that thing's holding up.
Okay.
I believe you're going to be just fine. Right?
All right.
So your homework is this. I want you to ice that low back of yours. Right? 20 minutes, 3 times a day. Right? And you got to keep that up for the next 2 months.
Okay.
Because it really does. We want to give you that sacrum the best possibility to bond really strong because it hasn't been bonded at all, ever since you were a teenager. Right?
Yeah.
All right, champ. Well
Okay.
said.
Thank you.
Oh, you're very welcome.
Awesome.
Okay.
All right.
So,
What's going on?
yeah, you told me.
Feeling a lot better. Yeah, still I'd say I used to be, my pain day to day was probably at a 7. It's probably at a 3 right now. Interesting too, because I felt like I had some, I don't know if it was maybe muscles atrophying down there, but when I used to bend over to pick something up, getting up, I almost felt like I was dragging a lead vest with me. That's gone. So yeah, so I don't know if something was going on with the nerve maybe, but feeling a lot better. I feel like a new man. I'm actually sleeping a lot better too.
Nice.
Yeah.
Oh, how was it impacting your sleep before then?
I wasn't sleeping. I was waking up probably every night, probably at 3 o'clock. At some point every night I would wake up. So, yeah.
So now it's uninterrupted sleep?
I've been sleeping like I feel like a new person.
All right.
Yeah, good stuff.
Yeah, it is. It's amazing, isn't it?
It is.
All right, let's take a look, see what we got. All right. So based on this instrumentation,
Mm-hmm.
all right, I'm not seeing any reading here at all. If anything, maybe possibly like a half point to the right. And very slightly. Yeah, it's so minuscule. It looks like it's healed. So let's take a look at the rest of you. Yeah, it's a tiny little reading there. Nope.
Now I'm going to check, see how this thing is healing up. So the swelling has reduced. You still have some over here on the left-hand side,
Mm-hmm.
but it's not as extensive as it was last time. See, this fellow is still pivoting. It's still moving. Yeah, it's moving both sides. This one's slightly stuck, but this thing, you have to remember, this fellow is still healing. All right, that's good. Let's check the rest of you. No, that's still holding up. Good. Relax his hands over here. Yeah, that 6 cervical is also holding up pretty well. All right, champ.
All right, champ. So based on our findings so far, right,
Mm.
I do see there's some swelling, okay, but it's moving, right? Before, that thing was stuck as heck, right? So that's what we consider very abnormal. Normal is supposed to move.
Mm-hmm.
There's slight little fixation in there. So based on everything we found, plus instrumentation, didn't really find any significant reading. Just went to like maybe like half a point, right?
Yeah.
So all the indicators are pointed to. And you've probably not seen this too often, but yes, there's actually a time where we actually have to stop adjusting it.
Okay.
So right now, today's visit, right, we're not touching this at all. Even though it's your second visit,
Mhm.
this is actually healing very well.
That's good news.
It is great news
Yeah.
because it's no different like when you get a cut over here
Mm-hmm.
and your body forms that clot.
Yep.
And then it starts scabbing over, right?
Mm-hmm.
Do we start picking at it, or do you actually let it heal?
You gotta let it heal.
Right? This is the same concept what we're doing over here as well, right?
Mhm.
We made a wonderful correction on the previous visit. That thing is still in the process of healing. All indicators showing it's still healing. We're gonna leave that alone.
Okay.
All right? All right, champ.
Sounds
Well,
good.
that's all it takes. Continue with the icing protocol, right? And then we'll probably do another follow-up in 2 weeks from now.
Okay.
We're gonna see how that thing goes up. But all intents and purposes, the way I see it, I think you're good to go.
I'm
And,
feeling a whole. Well, you have no. I comment on it every single day. Like I feel like a new man. So
all right.
it's good stuff. Awesome.
It is. And I don't think you need that surgery anymore.
I
either, right?
don't think so.
All right, champ. Well, it's good to see you. I'll see
Thank you.
next time. Hey, not a problem.
Appreciate it.
All right, champ.
All right.
Give us the latest
Good to see
update.
you.
Yeah.
Things have been feeling good. A little like nagging soreness in there, but nothing out of the ordinary. Just been putting some ice on it, and overall feel really good.
Okay.
Yeah.
How about all the other day-to-day activities you've been doing so far? How's that coming along?
I mean, day to day, it's completely different. I mean, I'm able to actually get out of bed without pain. I'm able to bend over and tie my shoes, things that like simple things that I couldn't do before. So overall, it's really good. I've been staying away from the things that you told me to, watching like no running or anything like that. But it feels really good. And so there's no, I don't feel like I have any restriction. I'm not locked up anymore. I used to, the whole backside was just all locked up and tight. So I can actually, bend over and almost touch my toes now, which is kind of amazing. So yeah, going really well.
All right, excellent.
All right.
Well, thanks for the updates.
Yeah.
So here's a promising thing what I'm seeing here. Right? Even though the instrumentation shows that there's just a slight little reading on this second sacral segment over here. And we're talking like not even 1 point, it's like 0.5, if even that. And what we're looking for is not how much it swings, we're looking for a pattern and how much to flex. And it's very, very subtle on this one. That tells us this thing's still in the process of healing, not much inflammation going on. So it's not like before when we test and check. So you used to have this speed bump here, right? And there's not much here. There's not much here either on both sides. Very, very slight. See, it's pivoting now. That's what we want. It's pivoting just fine. We check the fifth lumbar. That's also pivoting just fine as well.
So here's the story, right? So far, we did instrumentation, shows the reading is pretty much nothing there. Right? I also checked for presence of any swelling, any edema, any inflammation, muscle spasms. I also checked for is there any abnormal movement. Now, that component, what got you in trouble and caused you debilitated and made you also consider surgery and everything else, it's healing. All right. So because that particular way that thing corrected, most likely that's going to hold for the next 3 to 6 months or even longer than that.
Okay.
So since today's another checkup, which is a great sign, we're going to see you 3 months down the road for another checkup. All right.
Wow. That's it, huh?
Yeah, that's it, brother.
All right. That's awesome.
Also just that first adjustment.
Yeah, that's amazing. And to think that I was about to get surgery.
All right. Well,
Awesome.
Well said, champ.
Thank you so much. Appreciate it.
How you doing?